Hey guys, I had my first baby this year, and as a type 1 diabetic, I came to YouTube to try and find other people's experiences just so I could kind of have a little bit of a heads up, things to expect, and I did not find much. So I thought I would make a video both for me to have to look back on with my experience and also to maybe help some other diabetics out there that are just maybe wondering what to expect, what's a little bit different than maybe other pregnancies. But I probably don't have to say this, but I am going to say it. I am not a medical professional. Do not take anything that I say and be like, oh, I need to do the exact same thing. Always talk to your medical team, talk to your OB, your endocrinologist. Talk to them. Don't take what I say and be like, okay, we're going to do that too. But just going to share my experience, and hopefully it's helpful to those of you that are trying to find some more information. So I'm going to start by saying I am 31 years old. I have had type 1 diabetes for 24 years now. A long stinking time. My A1C when I got pregnant was a 6.5. But before I even started trying to get pregnant, I went and tried to find information. I went to YouTube, I searched books, and I did find one book and I found it very helpful, so I am going to recommend it to you guys as well. And that is Pregnancy with Type 1 Diabetes. I just got mine on Amazon. I can link it. I'll link it for you guys so you can find it easily. But this is what I have. It goes month to month and talks about the things you'll experience while you're pregnant, the changes it's going to cause to your diabetes, because your insulin needs are going to fluctuate. They'll go down, they'll go up. It's kind of crazy, honestly, if you think about it, but this book was very helpful. I started reading it before I even started trying, and then I referred back to it while I was pregnant. So very helpful. I do recommend it. So before we even started trying to get pregnant, I wanted to prep my body. I started taking my prenatals. I honed in on my numbers even more just so I could kind of get used to keeping a closer, tighter range on those numbers, just so I'd be kind of used to it. But by the time I did get pregnant, I was at a 6.5. And my first, if you see me looking down, I wrote down a bunch of notes so I wouldn't forget what I'm saying. But my first appointment was at 10 weeks. That's when my OB does their first appointment, just because you should for sure see something on ultrasound. So I went in, I had my first appointment, first time meeting my OB. I ended up loving him though. He was awesome. He told me he was comfortable with taking me on as a type 1 diabetic, but they would work together with the maternal fetal medicine, the MFM, just because that's how they do it there. So it's just like the high-risk OBs and then my OB. They all work together to make it a safe pregnancy. So after I met with him, he did send me to the MFM for a 12-week ultrasound. So that was my first one where they really took a good look at the baby to make sure everything was growing properly, and it went great. Everything was awesome. They said they couldn't really see much because I'm always only 12 weeks, but they took a look at everything and it was good. And then they also came in and just told me all of the things that are risks as a type 1 diabetic, so like larger babies, heart defects. There's a lot. You can look them up or ask your OB. They will tell you. I also will say that I do have white coat hypertension, so my blood pressure always read high at doctor's offices. But I did take it at home almost daily, and my OB trusted me on that. Like, he was like, I trust you. I don't think you would lie about that. But they did want to do just labs every couple of months just to make sure everything was still looking okay, because with the high blood pressure, preeclampsia is a risk factor. So they did just check that every so often, but I was good and like clear to go on that. So after my 12-week ultrasound, my next appointment was my 20-week. They did the anatomy scan, did all that, took an even closer look at the baby, and they like checked the heart, the liver, they check everything. And so everything on that came back perfect, but they did find that I had a velamentous cord insertion, which was not due to diabetes. They have nothing to do with each other. It's also pretty rare, but that's just when the umbilical cord isn't going like right into the center of your placenta, which can affect the baby getting the nutrients that it needs. And they just told me, like, you're already coming in for extra growth scans because of your diabetes, so we'll just watch that at the same time. So that was kind of scary to Google, but I would say try not to Google too much, because I'm going to tell you about things that I Googled But then I would talk to my OB and he'd be like, no, that's fine. But because the one thing I did Google was just like, what do I need to be like eating? Do I need to be, because as a diabetic, you're counting your carbs, and I wanted to do a lower carb diet just to make it easier to keep my blood sugar like super level. And so I Googled, do you have to eat a certain amount of carbs every day while pregnant? And the number was pretty high. And I was like, oh, that just makes it even harder to keep that number where I want it to be. And so I went straight to my OB and I said, hey, is it okay if I do a super low carb diet while I'm pregnant? Like, is my baby gonna be okay? And he was like, yes, like you can do a low carb diet. Your baby will turn what you're eating into what it needs, pretty much is what he told me, to simplify it. And so he's like, I'm glad you're taking this seriously. Like, do what you need to do to keep those numbers level. So I was like, awesome. So that is what I did. I found it easiest to honestly kind of just eat the same thing. I got very lucky and did not have any morning sickness. I had like days where I'd feel a little bit like, but I did not throw up at all while I was pregnant. Only once, and that's because I brushed my tongue too far back. You'll find that while you're pregnant, your gag reflex is crazy sensitive. But I got really lucky with no morning sickness. So I did eat a lot of the same thing just because I would know exactly how much insulin to take. I knew it didn't cause my blood sugar to jump up crazy fast or anything like that. And so I ate a lot of like eggs and salads. Almost ate the same thing like every day as long as I could stand it, and then I would switch it up. But that's like a really good tip that I would say, is just try to eat the exact same thing that you know how it affects your body, and it just keeps it simple. Because you'll also find that your insulin needs are going to go up and your pre-bolus time is going to get bigger. And so it's easier to know exactly what you're going to eat already, so that as that time gets bigger to pre-bolus, you already know what you're going to be eating. So you just take your insulin, wait the time, and then you can eat. So my next ultrasound was 28 weeks, and this was just a growth scan just to make sure that she was still growing properly, the right size, not too big due to diabetes or too small due to my velamentous cord insertion. And she was always like right on track, or even the tiniest bit bigger, but she was never like super big or small. And her heart, kidneys, everything looked beautiful. Every ultrasound, even though I was stressed, but everything went great. And these extra ultrasounds that you're going to get, it helped me because I am someone that gets anxiety pretty easily, but it really helped ease my mind to know that like, oh, she's okay. Or when I would get stressed, be like, okay, I have an appointment coming up really soon, and we'll get to check her and make sure she's all good. But I did have ultrasounds, so I'll just say when I had them. I had 10 week, 12, 20, 28, 32, and 36. Those were all the weeks that I had ultrasounds. So it sounds like a lot because I've heard other people talk about how like, oh, I only had my ultrasound to tell me that I was pregnant, or just the anatomy scan, and that was it. And I was like, that's so strange to me. It's like, don't you want to see the baby like throughout that? But you'll be getting a lot of ultrasounds as a type 1 diabetic who is pregnant. And like I said, do not be shocked at how much your insulin needs are going to increase. It gets more and more as your pregnancy goes on, and by the end of my pregnancy, my insulin needs were almost double what they were before I got pregnant. And it was shocking to me. Your insulin does not pass the placenta and get to your baby, but you're gonna feel like, oh my gosh, I'm taking so much insulin, like, is this okay? I asked my MFM OB, and she was like, yes, it's completely fine. Take all the insulin you need, because it's more important for you to keep those blood sugars within range so that your baby is not affected by the high blood sugar and packing on weight because they're getting too much sugar. So one thing that will be very different from being pregnant without diabetes is, at least it was for me, starting at 32 weeks, you will have 2 appointments a week, and they will be non-stress test appointments, NSTs. And I had no idea what this was, so I was pretty nervous the first time I went in. But these are a very relaxing appointment. I mean, it's a non-stress test. So they just will attach 2 things to your belly, one to measure the baby's heart rate and one to measure the baby's movement. And they're pretty much just making sure that your baby's heart rate is not dipping too low and that it's also rising and coming back down to where it should be properly with movement. But it's kind of awesome to just go in there and relax and listen to your baby's heartbeat for 15 to 20 minutes. I love these appointments. I learned to love them because it eased my mind, like I said before, and just getting to hear your baby's heartbeat was awesome. I loved it. So throughout my entire pregnancy, I had my OB team and my endocrinologist, and I was seeing my endocrinologist like every other month, I think it was, and a lot of those, with the day and age we're in, it was just a telemed appointment. So I would just upload my CGM and we would just go over those numbers, and they would tell me like, maybe you should up it a little here or lower it a little here. And it was awesome to be able to talk to both my diabetic side of things and then the OB who was focused on baby. And coming together, it was great. I felt the support wherever I needed it, and so always listen to things that your OB recommends and your endocrinologist, because they will know how to help you. You do know your body, and they will know how to kind of guide you in the direction that you need to go. I kind of just want to share my thoughts now on being pregnant with type 1 diabetes now that I have gone through it, and it is a lot of work. I'm not gonna lie. You are in charge of keeping your blood sugars level because they can interfere with your baby's growth, and it's a lot of stress. And you're gonna have days where you're like, oh my gosh, this is so hard, or days where your blood sugar goes high and you're like, oh my gosh, how did this happen? I was eating the exact same thing, but your body is just reacting to it differently than it used to because your insulin needs are going up. And just remember that you are doing your best. You know what you're doing. You have managed your diabetes for as long as you've managed it, and you can continue to do that while you're pregnant. And just on those hard days, just be like, I'm trying my best. I'm doing what I can to give my baby the best chance at life. And that's what I kept telling myself on those days. I should be like, oh my gosh, I'm failing. My baby's gonna have these problems because I'm messing up. And you can't blame yourself when you're trying your best. I wish I could explain how it's okay when you're having those days, because I definitely hit those days where it was so hard and so stressful, and I just kept doing what I knew how to do. I adjusted my insulin. I made sure to tie in my alarms on my CGM. I guess I should have said that at the beginning. I do have a CGM. Oh, it is on this arm now. I just put a new one on. I use the Freestyle Libre. That's what I used during my entire pregnancy. And then I also do multiple injections a day. I'm not on a pump. That's just how I've done it my whole life, and I prefer to do it that way. I've never been interested in a pump, but that's how I did it through my entire pregnancy. And I managed to keep my A1C between a 5.8 and a 6.0 my entire pregnancy. And it took a lot of dedication. Going through pregnancy as a type 1 diabetic in the holiday season was hard. I said no to a lot of things I wish I could have eaten, but I was like, you know what? This is just a short time, and I will enjoy all of the good Christmas treats next year, which we're about to hit, and I am so excited. But it's a short time to really tighten up those numbers, to do what you got to do for your baby's health. And I'm not saying either to you that you have to have these super tight numbers in order for you to have a healthy baby, because I've heard stories of diabetics that had no idea they were pregnant and their A1C was wild and crazy, and they still had perfectly healthy babies. So do not stress about, oh my gosh, my blood sugar was high 2 days in a row and now my baby's gonna have issues, because that's not always the case. it is important to keep those numbers within range, but don't beat yourself up when they're not. Because I've had plenty of days where they would go higher than they needed to be or way lower than they should have been. And in the end, I did have a beautiful, healthy baby girl. So this brings me to 39 weeks pregnant, and I was induced. I was told that it's safest for type 1 diabetics to not go past 39 weeks, and I trusted my medical team. So I was, in fact, induced. And I'm going to be doing this video in 2 parts because this will just get way too crazy long. So this is my pregnancy video, and then my next one will be labor and delivery, which I feel like there's going to be a lot of good info in there because I had some things happen. But thank you for listening. I hope that this helped either ease you or gave you some more information on just what to expect that might be slightly different as a type 1 diabetic who is pregnant. But stay tuned for the next video. Bye.